Hello, everybody. I'm Dr. Natalie Gentile. Welcome back to Rebels in Wellness, this awesome digital content series where we are talking to different rebels in the wellness world and healthcare industry across actually several other industries. We're learning about what people are doing in their world to try and bring about better well-being in the community. And I am so excited to introduce my friend, Dr. Dena Dunn, owner and founder of Acorn Psychology today, because I think you're going to be very interested in what she does. Good to see you.
Thanks, Natalie. I am so delighted to be here. Dr. Gentili and I really have connected on so many, I think, fronts of integrated health and whole person wellness, which is among many of the things I think that has sort of have brought us together. As Dr. Gentili said, I am owner of Acorn Psychology, and I am newer to Pittsburgh, not sixth generation Pittsburgher like others maybe around us, which I think really is an asset as somebody in the mental health field. I didn't go to high school with you. Nope, you don't recognize me from way back when. I think I have had the unique perspective maybe of sort of getting to see our community through newer eyes, through different lenses of living in different spaces and working in different spaces. So I'm just delighted to be here to talk about all the parts of how we take care of people and wellness more globally, including mental health.
So, mental health, I think, has become more near and dear to my heart as I've practiced direct primary care because I spend a lot more time with patients and I'm seeing how much their mental health plays into development of chronic disease in particular. Um, and I think that we talk about, you and I have had these discussions before about, we talk about wellness, and it's like kind of this sexy term that's only for a certain exclusive part of the population. But, one's well-being and health and well-being is so heavily influenced no matter where you live. It's so heavily influenced by all that's around you and really by your mental health. So can you tell us a little bit about, your thoughts on that and your thoughts on the importance of mental health?
Oh, yeah. As I said to you earlier, I feel like this is such an open-ended, broad topic that I could talk about it for a really long time. Things that are on my heart and mind right now at present for lots of different reasons, but include two main things, I guess. One being access to care. And when I say access to care, I mean both physical access, so transportation, um, cost, and time, but also access meaning accessibility. So, where can you find mental health? Who's accepting new clients? In the context of the pandemic, that was a really, really huge barrier to care for people. So, I think about and I also think about equity, and I really mean equity in contrast to equality, in the sense that one size really doesn't fit all. I think when I think about equity of care, I think about, again, same thing, sort of basic needs. So access to care and how people, can receive mental health care. And so, holding both of these things in mind, really, I think to put it in more accessible language, I just like to think about how important integrated healthcare is and wellness. And so, I know, Dr. Gentili, in your practice, you have such an emphasis on whole person care, right? So, physical activity, connecting with mental health, connecting with physical health, connecting with accessibility and access to, and just being able to afford care or get transportation to care, all of those things. So I think one of the sort of tenets of mental health care, of course, has always been historically destigmatizing mental health care. And one really powerful way to do that is through visibility. And so I think that I really value the way that you do your work and your practice in creating opportunities for access and visibility for everyone, which equals equitable care. But also seeking to serve people who don't look like us, who don't have the same resources or privilege. And how do we, for example, seek to serve families and patients who are part of what I'm learning to talk about instead of racial and ethnic minorities, but they're really part of the global majority, right? We are really global minorities when we think about race and ethnicity. But how do we actively seek to serve families who don't, necessarily feel like care is inclusive of them or their lived experience? So I know that this is kind of lofty and talking about big social and community ideas, but I think the importance of access and equity are really integral. And then, of course, just creating spaces where mental health is inclusive. Like you said, how important talking about mental health is. And you and I have talked off the record a little bit about how often you end up talking about themes related to mental health, whether that is motivation, right? Like, well, you don't exercise, but what is like driving you to want to exercise, right? Like, why do you want to even do that to begin with? What's the motivation other than that I'm telling you it's going to help your, blood pressure? And so finding people sort of intrinsic interest, or as it comes to child development. So as you know, my areas of expertise are in parenting and early childhood mental health. And so we don't know what we don't know. Parents might come to you having their own stressors, and you may be seeing a baby who, is undernourished or isn't sitting up, or right, like developmental milestones that we might miss because we just don't know how, as parents, to ask the right questions or have access to the correct resources. And so I think as we are seeking to help whole humans, we also need to be whole providers. And for me, right, whole person providers. And for me, that means asking the hard questions and knowing what are the hard questions to ask. One of my favorite tools for helping, early physicians is to think about how we're asking the questions, how you are in the room, not just what you're asking, right? And so one of the things I always like to recommend is not just how's the baby, for example, at a well child check, but ask the caregiver, what has it been like for you to take care of this baby? What a different way to be asked as a new parent or caregiver than just the focus on the baby's wellness. But as we know, right, that baby's support system is just as important to their well-being and their physical health in many cases as anything else. So hopefully those are a few tangible examples, but I think that the last thing I will add is I really believe in the power of integrated care. And so what I mean by that is, how cool would it be for a mental health care provider to be embedded, not just co-located? So not, oh yeah, you can see Dr. Dunn down the hall, but as part of your visit today, you're going to see Dr. Dunn and she's just going to check in and ask you a few questions, right? So lifetime integrated. Of course, as you are acutely aware, there are all kinds of barriers to truly integrated care, mostly related to managed care corporations and to payment. Right? So who's going to pay me if I'm just asking how your baby is, right? I'm not diagnosing you. I'm not putting a label. And so it's a huge barrier to care, more big picture and in big agencies. But I think the idea of that, mental health should be inclusive. If you went to the gym and your trainer just mentioned, how are you feeling? Like, have you been sleeping? What has it been like for you to like come straight from work to here, right? Just even like these little cues or clues of integrating mental health care into health education more globally, I think is a first way to start.
I mean, the destigmatizing part is so huge because it's so, we call mental health its own thing, mental health, and then physical. I mean, we're all one being, right? And so destigmatizing it and really, really saying that it's all one whole person is a first step into that integration of healthcare. I also will say what you do as a child psychologist, specifically, like as someone who specializes in young ones, is a field that I never even really understood or knew about until becoming a parent, actually, and then getting to know you and our amazing mutual friend, Dr. Julia Shaw, and just knowing, learning about what you all do. And I think that it's important for people to understand that you can see and help if a child has what we call issues or problems or things that we're trying to diagnose, but you can also see families to help even with like preventing bad stuff from happening, or helping them acclimate as new parents. I know for me, I used the services of a child psychologist because I wanted help with my own parenting. Like, I wanted parenting counseling to help me be the best parent that I can be. So I think it's important for, if you could share briefly just what you offer and what services you offer. I think more of the community needs to know about that.
Absolutely. Well, you brought up for me also just the importance, and I can't like be here without just naming it and calling it what it is, which is relationship based care.
Mhm.
And so by having safe relationships with your patients, they also feel comfortable being honest and open with you about what they are struggling with. So I think that relationships and early relationships are, such a cornerstone of what we do and also what we hope to offer the families we help. At Acorn Psychology, what I do, I'm a clinical psychologist by training, but I specialize in infancy and early childhood. And I really talk about what I do as doing perinatal mental health, but across the spectrum of sort of early or aspiring parenthood all the way into early childhood. So I work with people and families who are aspiring parents going through an infertility journey, or even through pregnancy. I also work with new parents, so struggling with, as you sort of talked about, Dr. Gentile, like struggling in the early days or weeks of parenthood with fussiness, with feeding challenges. I also help children in particular with special healthcare needs, so those who have genetic disorders or have been diagnosed with conditions that make some of those early regulatory processes particularly difficult. And then I do all kinds of parenting work. So I work with parents in all different spaces, whether it's helping with behaviors at home, like toilet learning or biting or sibling rivalry. I also help with more, for example, I work with some families whose children have been diagnosed with autism and who are autistic, and so learning to navigate the sort of strengths and areas of challenge as parents and talking to kids about that. I also then work with children, so across kind of mostly younger children, although I have a handful of teenagers in my practice. But I work with young kids with all kinds of different challenges, and then also adults. So I do a lot of work with people in all kinds of spaces, most of whom are parenting, but navigating all kinds of challenges related to trauma and depression, anxiety, things that unfortunately are near and dear to most of our lives and experiences after the pandemic and parenting through a pandemic.
Well, I feel like we could talk forever, but we're just all so grateful in the community for people like you who are going out there and putting yourself out there and spending so much time and effort to help us be more well, and whatever that might mean to you as a person. And so thank you for addressing some of the challenges and barriers that you've seen and for sharing what you do with us. And grateful for you.
Absolutely. Thank you so much for having me, and hopefully this is the beginning of many conversations like this to be had.
Absolutely. Everyone have a great time and day. Thanks for joining us on Rebels in Wellness.